So this is our flexion bias directional preference. So this is when, with your low back pain, like this feels so good, kind of bending down like this, and then any kind of like upright, like coming upright just kills you, and bending back, ooh, just like lights you up. And that when you sit, like instant relief, but when you're standing, walking, that just kind of kills you, okay? So with our flexion bias, the biggest thing is first, yeah, definitely sit, but you do want to try to walk as much as you can during the day. So we're gonna do a pelvic tilt first, and then I'll definitely show you what can help in getting up and getting upright, okay? So with the flexion bias, this is the one where when you lay down, if you bring your belt buckle up towards your nose and you flatten your back and round your back, that feels really good, okay? And then the other thing with that is that then when you go an arch, that kind of hurts. So belt buckle down towards toes, arch hurts. So you just go to it, but not through it with that arching. And then you go all day kind of tucking under. Now there might be an end range of the tuck under that's too much, so just go to it. And then with these pelvic tilts, since it's low load, you know, as much as feels good is good. You do just want to be aware with your pelvic tilts that if you over tuck like more than you need to, that you can then strain your muscles that way and kind of ruin your flexion directional preference. So that's one way. Then hands and knees, same thing. So you're going to bring belt buckle up towards nose, which rounds that back. And that should feel pretty dang good. And try not to cheat through the upper body, so you're really trying to keep it to the lower body, okay? So that should feel really good. And then also, you can tuck that under as much as you can. There's gonna be a pain point there, so try to increase that. Then also this child's pose stretch, just dropping back and flexing, should feel so good. So you can either rock back into that or hold it. So that, and you could walk it to either side. So that should feel really good. Then with standing, so the key when you come up is if you let this arch happen, which happens with most of us that aren't strong enough in our hip, it's gonna hurt. So if you can tuck your pelvis under, drive through, squeeze the tush to get up, that can help. Also, if you can kind of push down on some objects, that can help. So with standing, so usually standing and walking hurts, so you just apply the belt buckle up towards the nose to kind of tuck under and kind of flatten around your back, kind of into that flexion. And so just do as much as you need to kind of stay out of your pain, and then you can kind of walk and move around. This is also where if you did have a cane or some trekking poles or a walker to kind of lean forward into, that can help. So fight the urge to sit all day, since walking and standing does hurt, because it will just, the more active you can be, the better. And I promise you, the more you're able to walk with the right amount, the better you'll feel. So then getting up and down from chairs. So what you want to focus on is really, so what happens with a lot of us is we kind of do this thing and arch, and that's just going to light you up. So what you want to really try to do, you can use your hands if you need, but basically push through your feet, squeeze your butt, and then finish by tucking your pelvis under, and that can really help you stand up with much less pain by kind of tucking under and really pushing up through your legs and your glutes. You want to think about finishing tall, squeezing your glute muscles, and that will help with that. So that's kind of the initial premise. Sitting, and then usually sitting wise, actually slouching a little bit feels good. Okay, so with that, you want to do the kind of belt buckle towards nose, flexion under with a lot of your movements, and that will help you initially kind of flex till the cows come home. That usually feels good. And then as the extension stuff feels better, work into the extension bias playlist and work your way all the way through that to restore that. And all the meanwhile, work on your neutral core, your motor control, and your strength stuff as well to improve. So that is what helps with the flexion bias. Make sure that you don't have those red flag symptoms of sudden weakness in your legs or elsewhere in your body, loss of bowel and bladder control with going to the restroom, or numbness where you'd sit on a bike seat or wipe when you're going to the restroom. So cruise through that whole flexion playlist and kind of get that restoring, kind of work through it as you go, and then kind of move along to the other stuff and get back to life.